The arrival in Argentina of the first batch of 300,000 doses of the Sputnik vaccine from Moscow, a symbol of hope for the country's 45 million inhabitants, although health experts warn there are still difficult days ahead.
The
start of the vaccination programme does not mean the end of the pandemic. It's just the start of a road that will lead to 70% of the population being vaccinated. Today is important, but it's only the beginning.
After approving the vaccine on Wednesday, the Argentine authorities are working with their Russian colleagues to convince a sceptical population that it's safe, while negotiating with other producers for alternative vaccines.
As of today, we've not had anything against the vaccines. It's all positive. Who will choose to refuse to be vaccinated? It is complicated, but by law, vaccination in Argentina is obligatory.
Now begins the huge logistical operation of distributing the vaccine to the distant corners of this enormous country, the 8th largest in the world. A fleet of trucks is taking supplies to Argentina's 23 provinces, where 1,800 vaccination points are being set up. There's still a long road ahead, but in a country that's suffered more than 42,000 deaths and over 1.5 million infections, Argentina hopes that the arrival of this first shipment from Russia marks the beginning of the end of the COVID-19 pandemic. Frontline medical staff will be the first to be vaccinated, but health experts are keen to stress that the battle against the coronavirus is far from won.
Our concern is that the infections are rising, but we've been very focused on the vaccination plan and to prevent more hospitalizations and more deaths, especially in intensive care. So we're targeting the first of all those who are at the most risk and the most vulnerable.
The Argentine authorities are imposing fresh quarantine restrictions over the holiday period, trying to keep rising infections under control and the hopes and expectations for the recently arrived vaccine in check. Daniel Schweimler, Jazeera, Buenos Aires.